So the consultation is probably the most important part of the rhinoplasty experience because this is where the patient and the doctors get in sync as to what we're trying to do. Often patients come in and they kind of know what they want, but maybe they're looking at an Instagram photo or they're looking at a movie star or model or somebody they want to look at, or even a relative where they say, wow, I really like this person's nose. But so that's the dream. So now what I've got to do is I've got to take the dream and I've got to kind of bring it back into reality and practicality. And that's really my goal in the consultation process, is to try to get as close to the dream as possible, but inject realism, inject, safety, and kind of what can realistically be achieved. And this is a very nice process where at the end of it, we come to a meaningful understanding between the two parties, the physician and the patient, and we got a plan, and we can go ahead and do something that'll make everybody happy. So what can patients do? Bringing in photos is encouraged because what it does is it allows me to see what is the dream, what is the goal of what we're trying to do. Sometimes we say words and, it's kind of like, hey, I want to get rid of the dorsal hump and I want to do tip rotation and I want width reduction. And it often turns into, like, wah, 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 like the Charlie Brown thing. So I'm very big into photos. It's also why we invested heavily in imaging. We not only have two-dimensional imaging, we have three-dimensional imaging. And it allows us to kind of put into play the things that the patient wants and show them what it might look like. And often they'll say, wow, this is exactly what I mean. Often they'll be like, wait a second, maybe that doesn't look right. You took the hump off and now my nose looks too long. So, the imaging and the photos are nice tools to, again, help us get to that destination of the final goal. So here's some pitfalls that I've seen in consultation processes that sometimes we try to avoid. We live now in the selfie generation, and so how do people take selfies? They don't take it from here, they take it from up here. Well, when you take a photo from an angle up at the top, you actually distort your nose. It messes the lines up. And, I've got to kind of point this out, and we use a lot of our 3D imaging technology to kind of not only make a great nose when you look forward, but also kind of that selfie nose up to the up in the left. And that's actually a little complicated because, there's some optical illusions that occur when you do that. I like to see pictures of relatives, because we want to make sure that the nose we give you would be like the nose you would have gotten if you were born with it. One of our jokes is that, we want to make you look like your lucky twin sister or your lucky twin brother that just had the perfect nose. And the point of that statement is we don't want to put the wrong nose on the wrong face because people can pick that out from a mile away. If we go ahead and do a major rhinoplasty, I can do major changes, take out humps, decrease the size of the nose, change the rotation, and people will be like, oh my God, you changed so many facets of my nose. And then they go out and their friends are like, wow, you look better. Did you change your hair? It's new clothes. What is that? And my patients are flabbergasted. They're like, nobody noticed that 2-inch hump you took off my nose and the big pointy tip you lifted up. And that's because the new nose looks like you could have been born with it. And again, that's part of the art of rhinoplasty, is delivering a result that can't be picked out of a crowd. We just want people to look at you and say, wow, you look great. Not, oh, hey, you had your nose done. Who was your rhinoplastic surgeon? Again, that requires a lot of experience and a lot of sense of how the nose fits on the face. There's lots of different noses. There's not just a few different ethnic noses. Sometimes within an ethnicity, there's 16 or 17 different subtypes of noses. Hispanic nose, there's actually over a dozen different types of Hispanic noses. There's lots of different types of African American noses, lots of different Asian noses, lots of different Caucasian noses, lots of different South Asian noses. So having done rhinoplasty now for 29 years and done over 5,000 cases, often I can look at somebody and from my experience pull about 10 or 12 people that kind of look just like them. And they may be relatives, hopefully, maybe they are, maybe they're not. but I can show them before and afters. We have a very deep book of before and afters, thousands of patients that we can pull up and say, hey, look, I have somebody who is kind of very similar to you, and let me show you what I did for them. And that is very reassuring to the patient and really helps them see what I'm saying in person. So